The health and well-being of the community was always important in Rafa. And when I talk about the community, we always said that the members of the church were really the key stakeholders in Rafa, because of course it was through the church that Rafa was established. So priority for us was really to focus on the health and well-being, and particularly the Caribbean community population in the UK. So even though many over the last two generations started with the Windrush generation, have worked in health, but all the evidence shows that they don't have the best outcomes. And a lot of that is to do with the information, advice and guidance that the community receives. A lot of the time, many of our community were just not informed. So over a 5 or 6 year period, we had intense program activity around, and particularly around, we worked with the National Cancer Action Trust, which was an NHS initiative. And we worked with them all around the country. And we were able to distribute 17,000 information bags on the top 5 cancers. And that initiative was great because it had all the basic information, but most importantly, it had telephone numbers so people could get support. We also did a similar undertaking with the British Heart Foundation, where we circulated 15,000 healthy eating books and also exercise books around the country for all our activities. Again, we just really want to make sure that information, advice, support and guidance was there. And the support came by being able to contact somebody, and that was very important. We did activities around diabetes awareness and also dementia. We put on a special event called Thinking Ahead for the elders around all their issues as it relates to when they get older and needing support. We did a focus on carers as well. We launched the Carers Initiative because we knew it was important to think of people who are in a caring role as well, and the church in terms of the people and its locations had a lot of assets that could really make a difference to people's lives. And mental health, of course, in our community is a significant of concern and will be for probably another generation to come. And what we did there, we worked closely again through one of our church members, and we put together a program called Battlefield of the Mind, Faith and Spirituality in Mental Health Services. And we produced a report that was circulated to over 500 organisations. And then through that, we then put together a program to produce or to support the development of spiritual care advisors within the church. And then that led to another program called AAA, which stood for Attitude, Aspiration, Attainment. And that was actually working with the local police in the West Midlands. And that program, we were able to develop our work around our community pastors. So we actually had one of our pastors in the program who for over a year was able to spend 1 day a week in one of the local schools and actually being there to counsel and being there as a presence to both the school and the family and to the young people. That was a very good initiative, and that approach still continues today. Another innovative approach by Rafa was that we were always able to link themes, biblical themes, with the actual practical social action in terms of helping people. And a good example of that would be the Windrush social action program. And following the scandal that came about during the 2018 Windrush generation celebrations, we were able to partner with the Home Office and establish Windrush task force surgeries. And these surgeries took place after the normal church service on a Sunday. And so staff from the Home Office would stay 2 hours after the end of the service and provide confidential one-to-one information, advice and guidance to anybody who needed to regularize or to get information or to share with friends and families. And that was a very good initiative and very well appreciated all around.